Now we're going to do the stress test, the introductory stress test, to see what in our body is happening with our autonomous nerve system, the ANS. Usually the ANS should be able to be in a stress mood when we need it, and also in a relaxation mood when we need it. But often after a longer period of stress or trauma, our ANS is fixed in some kind of fight and flight mode, and our body doesn't function in the right way. You cannot relax, you cannot regenerate, and more problems appear. We lose our possibility to act as we would like to do, and to feel as we would like to do, and we don't consider that really. We just go on living like that, and our life gets darker and darker. So to test if our body is able to choose between the sympathetic mode and the parasympathetic mode, or the vagal mode, we have a test. We pull our leg as far as possible upward and watch the other leg. If this leg shifts a little, that's a sign that the iliopsoas on the left side has some tension. And we do that on both sides. In most cases, it's on the left side, the iliopsoas. The iliopsoas has a very strong connection with the sympathetic nerve system, as it's in front of the lumbar spine in the same fascial tissue together with the sympathetic nerve. And whenever we have stress, we get a tension. And if you have emotional stress, which is on the right side of our brain, so we get a stress on the left iliopsoas. And the second test, we hold our hip here and let it go outside and watch exactly where is the height of the knee and compare with the other side. And usually in stress mode we have less abduction on the right side than on the left side. So you have a typical sign of stress which shows itself in a torsion of the pelvis. I repeat it. That's the lifting of the iliopsoas on the left side, and that's a slight difference, not so much, in the adduction of the hip. So we know your valgus is somehow inhibited, and we want to see if your system can lose this sympathetic tone. And we have a relaxation point, the navel, and then we repeat the exercise. You can do it also yourself. You see the iliopsoas now is relaxed. And we can also check the other one and compare with this side. Not so really. Okay, so your navel is not really completely free because the adductors still have some tension. So we just check that. The navel is some point where all the fascia come together, and the fascia system is very strongly connected with the ANS. So now we check the front neck, which is also very strongly connected with the ANS. There are a lot of vagus nerves in this area. And again, we see this gives a relaxation here. And this is also okay. So this gives a relaxation here too. So your neck area is integrated in the system, but it has some stress. When you inhibit the radiation of the neck with your hand, this stress disappears and your hip is free. But with the navel, we saw it's not really possible. So we have to do something else. But before that, I want to ask if you have some scares on your body. Have you had some operations?
Yes, I did. I've got a scare from over here.
Okay, you just put your hand on your scare. You want to check the scare. It's not really relaxing. It was still have some tension. And also still some tension. So you have two possibilities. Either your scare doesn't make any problem, or your scare has a problem. You want to check that by the aura test. You hold your hand above your scar and you check it again. And you see now your ellipse source is relaxed. So completely. So we can say that your scare has an energetic problem too, that we will solve soon. But you first want to see if your navel also has the possibility to relax when you hold its aura. The focus is on the navel. Not really. Still some tension. So now the problem is a little more complicated. You hold your hands here and you imagine that your arms are getting longer and longer until you feel a relaxation. You can also imagine that a third hand is coming from upstairs slowly downward, and when you have the idea it's close, it gives me pressure, you just hold it and go a little backward. And imagine that you open your big arms just in this field where the pressure begins. Okay, and now we want to check it again. What did you feel?
My arms getting longer and longer, and I think some pressure was leaving my body.
Okay, and you want to check? And now your ellipse source is completely relaxed, and your adductors also. So you had some problems in the aura of your navel. Often that is some old thing. Yeah? It might go back to your birth or even before that, but also can be something that happened in between this time. It's difficult to say. The important thing is to watch if your muscles don't relax with this distance. You can use your imagination, but it's also possible to work with some friends or therapists. They come close to you with their hands, and as soon that they reach a distance which is uncomfortable, they open the field, the trauma field. Okay? So now we have done the first step in a direction of relaxation, and this gives a movement in the body. Just watch your body, what is happening in the body. It's like
it seems like something is working in my stomach and in my chest.
Mm-hmm.
I can't explain it exactly, but there's something going on.
There's something going on. The ANS has discovered, there's some pressure which has left me, so I can organize myself in a new way. And that affects all the body. And it's also possible that emotions come up. So watch emotions as well, to see if some sadness or whatever which you have stored in your energetic field that leaves now the body. Can you feel slight emotions come up?
There's a little sadness, but there's more pressure leaving my body.
Okay. It's possible that emotions come like a waterfall, but it's also possible that they only come drop-wise. We have made an opening now, and it's possible that in the next days or the next weeks, the next months, the system recovers slowly. And if we are in a therapy, in psychotherapy or in osteopathic therapy, the therapist probably will say, what has happened? Why are you so relaxed? The work is getting much easier. So we will check if this relaxation stays. And it's good. If it stays more than a couple of minutes, we can say it's one very important source of your stress mood, that big energetic field that you have lost now. So, but we have also seen that the scare here was a problem, and as we have made this exercise properly, the energetic problem of the scare has solved too, but we will see we have some other problems. Go on the scare. And now that the body is relaxed, the test works the other way around. If the scare is still a problem, the tension comes back. Okay? From the relaxed mood, the test works oppositely. So we know the scare is still giving a problem. So try to move it very, very softly in the direction that gives you an easy feeling. You can also use the fingertips. You have the direction? Okay, and then you do the same with the navel. Just move it very, very softly in the direction which is easier. The free direction. They say in orthobionomy. Orthobionomy is something which works also in a similar way, and I use it in my daily practice. So hold it as softly as possible, as well the navel as with the scar. Okay, and now we go to the deeper scar. Go with your imagination of the fingertips a little further in your body until you reach the peritoneum. And then imagine that you are in touch with it. Imagine that you move this field to inward, outward, upward, downward, as if you have some light in your fingers, and this light is trying to find the easy direction. And then go in the easy direction with the light. Okay, so that's from time to time necessary to repeat that. Not so often, maybe you try to do it once or twice in the beginning, and then later on, whenever you have the idea you need it, you can repeat also the scar integration. But for the daily practice, it's enough that you open your arms, especially when you come back from your consultation. Working with so many patients, you get a lot of stress. Mm-hmm. And you have to get out, release all this stress. So when you come home, open your arms. You can do it standing in front of the window or in the garden or wherever. Mm-hmm. Let the stress go out. Mm-hmm. And then either sit or lay down. Connect your throat with the navel. That's enough. Okay? Thank you.
Thank you.